We'll talk something about diabetes today. How does one reduce the risk of passing on diabetes to the next generation? Genetics is just one of the risks causing diabetes, but lifestyle plays a major role in people suffering from diabetes. Making lifestyle choices help people to reduce the risk of diabetes, particularly type 2 diabetes. The lifestyle modification required in such cases are maintaining a healthy body weight, being physically active and eating healthy, balanced meals. What is a diabetic emergency? Insulin is a major treatment choice for diabetic patients, whether type 1 or type 2. The incidence of too much of insulin or too less of insulin both can cause diabetic emergencies. Too much of insulin can cause hypoglycemia, and if left untreated can cause coma in the patient. And too less of insulin can cause hyperglycemia, and again if left untreated can again cause diabetic coma in the patients. Reviewing signs and symptoms of hypoglycemia versus hyperglycemia helps remove the challenge of determining if a patient's blood sugar is too low or too high. In either case, high sugar or low sugar both are in diabetic emergencies, which need to be treated aggressively. So we'll talk something about diabetes today. First, we'll discuss what is the impact of diabetes in women. Diabetes can be especially hard on women. Women with diabetes are also more likely to have a heart attack at a younger age than women without diabetes. Diabetes increases the risk of heart disease in women, and it is one of the most common complications of diabetes. And it increases the risk of heart attack in women by almost 4 times than a non-diabetic lady. Women are also at a high risk of diabetic-related complications like blindness, kidney disease, and depression. Diabetes in pregnant women can affect the fetus, and diabetes can cause difficulty during pregnancy, such as miscarriage or baby born with birth defects. Talk something about women and diabetes today. The risk factors for women to develop diabetes are an overweight woman, as per Indian criteria, BMI of more than 23, and have one or more additional risk factors such as low physical activity, family history of type 2 diabetes, high risk race ethnicity, had a baby weight weighing more than 4 kg or more, or were diagnosed with gestational diabetes before, high blood pressure and a high cholesterol levels, history of polycystic ovarian syndrome, and history of cardiovascular disease or have prediabetes. These are the risk factors for diabetes in women. I talk today about effect of menopause on diabetes. The changes in the hormonal levels and their balance when a lady attains menopause may lead to blood glucose levels that may be difficult to control and may be out of control. Women with diabetes are also at high risk of developing premature menopause and the consequent increase in the risk of cardiovascular disease. Diabetes and menopause may team up for varied effects on the body, including fluctuations in the blood sugar level, weight gain due to menopause resulting in resultant increase in insulin requirement, and or addition of oral medication. Sleep deprivation can make tougher to control diabetes, and there may be an increased frequency of urinary tract infections and vaginal infections.